higher, and anyone with chronic kidney disease. Now, these categories are in addition to the serious health issues that are already approved for vaccines. So I'm going to repeat it one more time for those in the back. Everyone 50 years of age and older, those with diabetes, type 1 or type 2, those that are obese, which is a BMI index of 30 or higher, 40 or higher was already included. So this is now, we're adding those 30 and higher, and anyone with chronic kidney disease. Now, let me stress, and we've said this many times, we are always striving to have more demand than we have vaccines, to make sure that we aren't having any appointments that are going unfilled. This is a huge addition to eligibility, which means that it's not going to be possible for everyone in these areas to get an appointment right away. You're going to have to be patient. You're going to have to keep checking back. It may take a couple weeks for you to be able to schedule your appointment. I will also say that please do not start making appointments until Monday. Again, these eligibility requirements go into place on Monday, March 8th. Please do not start making appointments until Monday, March 8th. This will give our partners an opportunity to get their systems ready, to get their websites ready, to ramp up call centers, and we urge you to be patient. We will overwhelm call centers, we will overwhelm websites for a time. We know that that's going to happen. We're continually beefing up our capacity, with our server capacity, as well as our call center capacity, but we are adding a very, very significant, this is the largest group we've ever added, and we are having more and more vaccines come into the state every week. That's why we feel comfortable doing this and making sure, again, that we have people working to get these appointments. I will also say that what's really important about the announcement today is, for right now, and using the Utah profile, and Dr. Dunn can speak more to this or answer these questions much better than I can, but we will now, with these announcements, every category in the state of Utah with a risk factor above 1 will now be eligible to get a vaccine. So everyone else, those of us that are younger than 50 or those of us that don't have these comorbidities, our risk factor is less than 1. Still, again, serious, and we must continue to take this disease seriously, which will lead me to my next announcement. But having everyone eligible now that are truly the most vulnerable to this to this disease is a really big deal, and will help us over the month of March. Now, if we continue to get the vaccines that we think we're going to get, and we continue to move through and we're able to vaccinate this category, we anticipate and hope that by April, the beginning of April, we'll be able to open up eligibility to every adult in the state of Utah. That's what we're shooting for. I give all of these caveats. I know everyone wants to know what's coming next, and so I'm previewing for you what we think will be the next thing, and that is by April, we'll be able to open it up broadly to every adult in the state of Utah. That's the direction we're headed. That's our goal. Assuming everything works out according to plan, which it doesn't always do, but if it does, then we will be able to open up vaccinations to every adult in the state of Utah by April. So this is really good news. It's really encouraging news, and we should all be hopeful and excited. Now, I want to talk about the transmission index just a little bit. Even though we've been watching, again, phenomenal progress in our metrics, I want to take a minute to just remember that we have lost almost 2,000 Utahns to this insidious disease. We were reflecting a little bit as we start to approach the 1-year anniversary of so many things that happened, and I remember sitting down with Dr. Dunn. It was in March, fairly early in the pandemic and what we knew coming out of China. And I just asked her, I said, give me your best case scenario and your worst case scenario with what we know now about this disease. And she said, well, just again, with what limited knowledge we have, worst case scenario, 20,000 Utahns could die. Best case scenario, 2,000 Utahns could die. we're very grateful and excited that we are on the best case scenario side of that Utah has weathered the pandemic better than just about any other state, that we're approaching those 2,000 deaths. But those 2,000 people are real people, and to those families, this is real and it's tragic. Some of these are my friends, my relatives, people from my small town that I grew up with and admired deeply. And all of our lives have been impacted by this in one way or another. The good news is, though, that this disease is waning, that we are seeing numbers come down, and that should be encouraging to all of us. We're so close now, and we want to continue to be vigilant. And I want to share where we are with the transmission index, because this is really, really more good news. We now have 11 counties in high, 13 counties in moderate, and 5 in low transmission. Now, I want to announce the new counties that will be moving into the moderate category. They include Cache County, Davis, Grand, Salt Lake, Sanpete, and Wasatch. Some of those counties have been in high transmission areas since we started using the transmission index. This is really incredible progress, and it means that now 2.2 million Utahns live in moderate transmission counties. And it's important to note, this has been a little frustrating because even legislators keep asking, why do we have things locked down, without realizing what is happening in the transmission index? And the truth is, we don't have things locked down much at all. In fact, 99% of the economy has been open for some time. And in moderate, this is really important now, there are no restrictions on gatherings in moderate. There are no restrictions on the number of people that can gather in moderate, so long as they are wearing masks. Now, there still are some requirements around signage. At restaurants in the waiting area, parties need to have some separation of 6 feet between them. You can't eat concessions in your seat in large gatherings, but you can outside in the common areas where 6 feet can be between people. But in moderate, there are no more restrictions. And this is incredible news, as long as people are wearing masks. That's the only important caveat that is included there. Because with what we know about masks in low and moderate transmission areas, you can be safe. Again, with improved masks, you can be even safer and can make those decisions that are right for you and right for your family. But we can start to open things up in a big way. And that's great news for our economy, and it's great news for the citizens of the state of Utah. That's where we are with our announcements. I know that's a lot to take in right now, but we have something else. Let me just share quickly on our vaccines. As I mentioned, the Johnson & Johnson vaccine arrived yesterday. We received 23,000 doses, and first vaccinations are expected to happen today with that vaccine. This is an important vaccine, not only because it prevents hospitalization and death, but because it gets the job done in one shot. And that's just critical for so many in our population. Just the numbers, we've now administered over 785,000 doses, and those are first and second doses. A week ago today, our total doses administered was 660,000. This is a weekly increase of 125,079 doses, which is by far our best week ever. And I'm so proud of all of our vaccine partners and the people that are doing this work. It's the most by a long shot. I think it's about 20,000 more than we had ever done in a week. 75% of Utahns age 70 and older have received at least one dose of their vaccine, which is just the best news we have yet. And 52% of those ages 65 to 69 have also received at least one dose. So we're just blown away by those numbers. I just have to tell you, too, to our volunteers, over 4,000 volunteers, you have been incredible. I mentioned on Twitter last week that my mom has been volunteering at one of the sites, and every day she cries because the people who are getting the vaccine are crying because they're so happy to have this vaccine in their life. It's literally changing their lives. They're able to hug their grandkids again, able to spend time with family and friends again. It's a blessing to everyone involved in the process and to everyone who's getting them. So thank you to all of you. Now, we've talked a lot about the importance and the need to make sure that many of our communities who have struggled historically with healthcare and other issues, and especially around the pandemic, are communities of color and other congregate settings, harder to reach settings. We want to make sure that they have access to the vaccine, that we have equity in distribution. And so Lieutenant Governor and her team have been working on this as well, and I'm going to turn the podium over to her for some announcements around that effort. Lieutenant Governor Henderson.
Thank you, Governor. Good morning, everyone. It's a pleasure to be here. As the Governor mentioned, we've been very concerned about making sure that everybody has access to the vaccine. And so we've been working really hard. The Department of Health has brought together stakeholders from various communities and partners to make sure that we're getting this right. We really are excited to be able to once again gather safely together with our family members, with our loved ones, with our friends. And in order to do that, we really do need to make sure that everyone has the opportunity to get vaccinated. Now, vaccine administration and distribution has been the most important thing that our administration has been working on this year. But one of our top priorities with that has been to build an inclusive vaccine strategy to make sure the vaccines our vaccination rates actually reflect our population. Our goal is to make sure that vaccines are administered fairly and equitably, and that every Utahn who wants a vaccine can get one, regardless of who they are or where they live. Today, I'm pleased to share our administration's vaccine distribution roadmap. Our goal is to have all vaccine providers in the state implement this plan. This roadmap gives guidelines for providers to ensure the vaccines are administered equitably throughout the state, especially among those who are most vulnerable. Now, it's really important to note that these guidelines will continue to evolve as we receive feedback from our vulnerable communities and our frontline partners throughout the state about what it is that they need. This roadmap sets the direction for how to engage in practices that recognize the unique needs of historically underserved communities, including racially, ethnically, and language diverse populations, as well as those who are experiencing homelessness, people with disabilities, people who live in congregate settings, individuals who are homebound, people who lack access to transportation, rural and frontier communities, older adults, and households without access to computers or the internet, tribal members, and people who may have a hard time taking off work in order to go get vaccinated. The Vaccine Distribution Roadmap directs vaccine providers throughout the state of Utah to identify and remove barriers to access so that we can recover together without leaving anybody behind. The strategies of the Vaccine Distribution Roadmap include identifying priority and high-risk populations, developing messaging that works for all Utahns, reducing barriers at vaccine clinics, creating vaccination sites in communities, and establishing mobile vaccination routes, and making vaccination data available to the public. In practice, this means mobile vaccination vans that travel to specific locations, including senior centers, correctional facilities, and neighborhoods, wheelchairs and golf carts, private areas at some sites that are curtained off at some locations for those who wish to have a little bit more privacy when they're receiving their vaccine, clinics for those who are deaf or hearing impaired and those with visual impairments. So far, the state has spent about $1 million on language translation efforts. And on Utah's coronavirus website, you can find information on distribution, clinic locations, and vaccine facts in more than 20 languages. We really appreciate our local health departments and other community partners who have already been addressing some of these issues, and I want to give a few specific examples. Tri-County Health Department is working with faith-based leaders in multiple languages to ensure that hard-to-reach populations have appropriate information. Salt Lake County Health Department posts on social media in English and Spanish. They've provided clinics in languages including Farsi and Somali. The Bear River Health Department provided a worksite mobile clinic in partnership with others to vaccinate over 130 65-plus employees. Translation was provided by the worksite teams. Carbon County provided assistance for individuals with visual impairments with a mentor to assist in receiving vaccinations. And we've partnered with our local Hispanic media partners to do virtual town halls about the vaccines. It really does take a whole community to reach out to the whole community. So we're grateful for those who have given input on this roadmap and who continue to provide feedback and help us to know where the needs are so that we can best reach those locations. Thank you very much. By the way, the vaccine distribution roadmap can be accessed at coronavirus.utah.gov.
Okay, good morning. Our 7-day rolling average of new cases is now 558. That is a decrease from last week when we were at 723. Similarly, our percent positivity has decreased. Our person over person percent positivity is now at 10%. That's a decrease from 12.5% last week. And test over test, we're now at 4.8%, a decrease from 5.7% last week. Our referral ICU utilization is at 73.5%. So the governor and lieutenant governor just talked about really exciting info about our vaccinations and how many we've been able to give in the past week. And our pace is certainly only going to increase as the manufacturers deliver more vaccines to the state of Utah. The most frequent question I'm getting these days is, which vaccine is best? We've got 3 vaccines out there, which one should I get? And I'm here to tell you that the best vaccine for you is the one that you can get first, regardless of the manufacturer. It's so exciting. We have 3 effective and safe vaccines against COVID-19 right now. There was a time not so long ago where we weren't even sure we would have 1 vaccine that was effective. So the fact that we have 3 means that we can end this pandemic sooner, and it's going to take everybody getting the vaccine when it's available to them. And that's how we will stop this pandemic and save lives. Thank you.
And with that, we have time for a few questions.
Yes, Governor, this is Jed Bowl. Hope you're doing well this morning. We've seen an uptick in cases nationally, 3.5% over the last week. Are we starting to see those kinds of things here in our state as well? And what is your level of concern about those variants that are causing problems in other states?
So thanks, Jed. The answer is no, we are not seeing any of that here in the state of Utah. In fact, if you look at just the past 4 days, and I always encourage people, when you're looking at this data, I think maybe most people understand this by now, don't look one day to the next. Always compare the day of the week with the day of the week last week. That's the best way. That's how you know whether our cases are coming down. And every day this week, our cases have been down over last week, including today, where we had a reduction of, I think, more than 200 cases just today. Same thing, 80 cases, 200 cases on Monday, 80 cases on Tuesday, or whichever, I may be mixing those up. But we continue to see a 10 to 30% decrease almost every day, week over week, which is, again, in the transmission index, why we're able to move down. So, of course, we worry about those things, and Dr. Dunn will, in fact, I could have her come tell you, but Utah tends to lag behind a little bit the rest of the country, so it is possible that we could see upticks down the road. But the good news is, again, we're racing with the vaccine, right? So even though we may lag the rest of the country in some of these, this is the best time to lag because we're not lagging behind in vaccines. And the more of our adult population that gets vaccinated, the less likely it is that we will face some of those upticks. And so they're not big upticks. Again, as you said, there's kind of a leveling off, maybe a 3-point gain in some places. I think New York and others are having some higher case rates and some higher percent positivity rates than some other states. But for us right now, every day continues to be good news. We've now gone a couple weeks without a case, with less than 1,000 cases. We're looking much more like early September, late August in our numbers, and we're excited to be there. So that's why we're pushing to get vaccines out, again, to our most vulnerable, just pushing, so that if we do have a resurgence or we do see some of those those variants coming on board, that we're better off. Dr. Dunn, anything you'd like to add to that? Okay, I answered it right. We're good.
Hi, Governor. It's Ben Winslow with Fox 13. I wanted to ask, of course, about bills pending in the legislative session that might lift restrictions, including the mask mandate by the legislature. Is that cruising for a veto, some of these bills dealing with the health restrictions?
Well, Ben, I can hear the chimes in the background, so I think we know where you are, and we all have a little PTSD with those chimes at this point in the session. We're almost 24 hours away, I guess a little more than 24 hours away from the end of the session. Look, we're working very closely. We're watching this closely. I hate that we're having these fights again right now. We're so close to the end of this. And by the way, there are a lot of good things in that bill. Things that we agree with. We're all so close. The end is in sight, and it just reminds me a little bit of Rich Saunders uses this analogy often, that we're in this boat and we're trying to get to the shore, and we're at the place now where we can see the shore, and if you're a healthy swimmer, you can jump out and you can make it, but we have some not healthy swimmers, and we would really like to get them vaccinated. That's really important, and that's why we announced this change today. By the way, really good for the economy too, because they feel safe, because cases are coming down, and because, again, people are wearing masks. And I have to say, it's been impressive. Our latest data shows that over 80% of Utahns wear masks regularly and are okay with it. Now, none of us want to see it continue one day longer than we need to. I've said this before. I can't wait to not have to wear a mask. That day is coming very, very soon. And so, look, whether or not that mandate goes away, businesses can still require them. People can still wear them, and they should, until we can get vaccinated, right, and get them their second dose of the vaccine. So we're concerned about it. We're talking. Yesterday, the Senate President mentioned, is this really necessary? And especially with these counties moving to moderate now. There's a really good argument that it's not necessary, that we can do everything we need to do and just get these most vulnerable vaccinated. That's all we care about right now, is getting the most vulnerable vaccinated to keep them safe. So we'll look at it. We'll see what happens. We'll see as it comes to my desk what's ultimately included and where it ends up, and then we'll make a decision.
Governor, hi, Sean Means, the Salt Lake Tribune. Pinging off of what Ben was asking, you have states like Texas and Mississippi and others that have ordered immediate mask mandate removal. Considering the messages we've been getting from the CDC, from Dr. Walensky, that saying that we sort of need to still tough it out for another month or two, or we're going to have a fourth surge. What is the logic, do you think, behind any drive right now to remove masks prematurely?
Well, I mean, you can talk to them about the logic. I think my previous answer to Ben probably covers this. Again, nobody likes the mask, and nobody likes government telling us what to do, and I agree with that. I wish we didn't have to do this. I wish we never had to have any of these orders whatsoever. But we also know that from an economic standpoint, the mask mandate is the least intrusive of all the mandates, and again, allows us to get back to normal quicker and allows us to do so many more things, allows more people to participate in the economy. And the data is just really clear on masks that they are instrumental in keeping us safe. Now, the good news is, unlike what we had before, is that people have access to masks now where they didn't a year ago. People have access to higher quality masks that we didn't have before with KN95 or N95 masks or double masking. And so there are certainly more opportunities for us to do that. So look, we're all really close. Whether it's a few weeks earlier or a few weeks later, we obviously don't want to see another surge. I don't know. We've had surges predicted that didn't happen, and we've had surges not predicted that did happen. So I don't know how accurate those predictions are going to be, but I do know that what we have are vaccines. And what I do know is that these vaccines work. And what I do know is that if we get more people vaccinated, then people won't die, and then we won't have to wear masks at all. And that's what I'm really excited about. And the sooner we get there, the better. So I'm going to keep focusing on getting our people vaccinated. My team's going to keep focusing on getting our people vaccinated. The legislature, they can do these things. They do. They get to decide policy, and so we'll continue to work with them and work on those things. But I'm going to try to vaccinate as many people as possible before that goes away.
Is there a concern that the legislators are feeling pressure from, because Texas and these other states have gone ahead?
Oh, sure. Yeah. No, I mean, look, there's no question that that's the case. And we always knew that that would be the case, right? There are people who want to run for president, and there are things you can do to get some attention. And, look, every state has done things differently. And that's the cool thing about our country, is that we get to do these things, and we tackle it differently. I will say this, look, and maybe I'll share this. We have a chart that shows every state, and it shows, you have your x-axis and your y-axis, and on the one side we have the unemployment numbers, and on the other axis we have the number of deaths per capita. And then by the size of the dot, it's how many restrictions we have in place, right? And so there's this corner you really want to be in, and it's the corner where your economy's doing really well and you don't have any deaths, or you have fewer deaths than everyone else. And in my mind, also, if you have the fewest restrictions and you can be in that corner, that's like the best of all worlds. And Utah is firmly in that corner, one of just a few states that can say that. And so when you compare what we've done, we've made it through with, we've been top 10 in fewest restrictions, top 5 most months in the fewest restrictions of any state in the country, and we've had we're bottom 5 in deaths per capita, right around there. I mean, we have a fourth of the deaths that the Dakotas have. We have a fourth of the deaths that New York and New Jersey have. We have a third of the deaths that Texas have had, or close to that. So I think we're doing it the right way. I really do, and I'm really proud. We haven't been perfect. We've done a great job. But yeah, we're going to feel pressure. Everybody's going to feel pressure to open up quickly. And I want to open up quickly. And we are opening up quickly. Again, I can't emphasize this enough. In moderate, there are no restrictions on gatherings. So that means Hale Center Theater in Salt Lake can have their seats full with people wearing masks. We can do that right now. Theoretically, sports teams now, if they want to, could bring in people and have them sit right next to each other. They couldn't do concessions in their seats. They would have to do those out where people are spaced. But that can happen right now in all these moderate categories. And by the way, at the rate we're going now, every county will be in moderate in the next couple of weeks, it's looking like. We're really close in Utah County. Most of the Wasatch Front is close. Some of our rural areas are already in low transmission index. So we're in a really, really, really great spot. I would hate to do something that sets us back when we're this close, but again, I don't want these restrictions in place one day longer than is absolutely necessary. One more question, and then I know Dr. Dunn will still be available for questions. KUER. I see a hand raised. Lisa? Oh, is Lexi on? Go ahead, Lexi. Can you hear us, Lexi?
Oh, yeah, I can hear you. This is a question either for the governor or Dr. Dunn, but we're talking a lot about optimism right now, but just thinking about some of the hardest hit communities, one third of the deaths in Utah have been from long-term care facilities. And I'm just wondering if you can give an update on where we are in vaccinations and how these facilities are recovering.
Sure. Let me give a quick answer, and then I'll let Dr. Dunn finish up, and she can take other questions. So we've had enormous success in our long-term care facilities. Now over 90% of residents in long-term care facilities have taken the vaccine. Every long-term care facility in the state has had the option. There are just a small percentage that opted not to get the vaccine, but again, over 90%, which is really good news. We also, I don't have the data in front of me, but in comparing Utah with other long-term care facilities, we're at the top of the list. Now, again, as you mentioned, a huge number of over, I think it was close to 40% of our deaths have come from long-term care facilities, and that is obviously very tragic and of concern to all of us. But the good news is that most of them have had their second vaccines by now. I can tell you, my own grandmother, 94 years old, who is in a long-term care facility, was able to get her second vaccine a couple weeks ago. I haven't been able to visit her because of this session, but I got a picture of her 2 days ago, no mask. She's got her St. Patrick's hat on, and it was just awesome to see how happy she is because she was able to get that second dose of the vaccine and now has the full immunity. It's been more than 14 days since the second dose. So great news there. I'll let Dr. Dunn finish that up. But again, let me thank all of you for helping us get the word out. We're so excited. Just a reminder, please be patient as you hit some roadblocks with this new category. Over 700,000 people that we just opened the door to, and so we'll get to you as quickly as we can, and hopefully by April, the rest of us, including me, will be eligible after April 1st. So thanks everyone. Keep up the good work. Take care.
Great. Dr. Dunn, this is Chris Reed, St. George News. The transmission index was brought up earlier. Garfield County in southern Utah was one of the first to be placed on low about 3 weeks ago, where all restrictions were pretty much lifted other than the mask mandate. This week, Garfield has gone from low to high. So two questions. Number one, can you put that Pandora's box back in the bag and say, hey, you had no restrictions, now you have all the restrictions again? And two, is this maybe creating a false sense of safety or a false sense of, hey, we can just go back to normal? And is Garfield County possibly an example for the rest of the state in this regard?
I mean, I think that shows that the transmission index works, that it's really sensitive to these fluctuations in COVID spread, so that when we do start to see a slight increase, more restrictions are put on the county to make sure that it doesn't spread throughout the state. And I think Garfield is a good example of this. They went back to high because their total case counts, right? They were seeing more spread, and the third metric, or the second metric they met was, of course, our hospital capacity is limited throughout the state, and that's a statewide metric. So I think it just shows that, our transmission index works. It's sensitive to COVID spread and can limit the spread from being sustained. So it's a good thing.
And their percentage positive also increased. But just as a follow-up, how are you able to tell people, hey, everything is fine, it's low, you can go about doing everything as normal other than masks, and now you're going to tell the same people? Do you see any kind of pushback on that, as far as people saying, well, hey, you took all my restrictions away and now you're putting them back?
Sure. I mean, I think it is really hard for individuals to kind of fluctuate between restrictions. That's why it's so important, once anybody gets to moderate or low, to continue being cautious and follow the basic principles of staying home when you're sick, avoiding large gatherings, and always wearing masks, because we're definitely not out of the woods, as everyone keeps saying, and there are a lot of cases out there that can still result in spread. So even though a jurisdiction may be in moderate or low, or certain restrictions may be lifted officially, that doesn't mean we shouldn't still, it means we still should be very cautious in our day-to-day lives as individuals.
Hi, Dr. Dunn. I'm wondering if you can talk about how the state is looking to the federal government for funding on these vaccine contractors. I understand the price tag will be about $44 million or so to get those vaccines administered through not only NoMe Health, but the 4 contractors hired yesterday. I'm told that money is supposed to come through FEMA. How sure of a thing is that? And what happens if that money doesn't materialize? Does that come out of the state budget? I recognize that might have been a better question for the governor, so
Yep.
Thank you.
Not involved in budget discussions. Sorry,
Okay.
Lisa.
Hopefully someone in the governor's office can get me an answer to that.
Sure.
That'd be great. Thank you.
I have a question. This is Jacob Klopfenstein with KSL.com. Obviously, Texas and Mississippi were mentioned a little bit earlier, with those states basically fully opening up. Dr. Dunn, I'm interested in what you make of that from an epidemiology standpoint. Obviously, Texas is a huge state with a big population. Does that have adverse implications for the spread here in Utah, even though, we're a couple states away?
Sure. I think nationally, we're all really concerned when states open up their states or release restrictions seemingly too early. As we know, this virus does not respect boundaries, even international boundaries, but especially within our own state. We're only as safe as our weakest state. So if there's spread going on in Texas or another state, it certainly puts Utahns more at risk for spread. So the best thing we can do, and I'll just reiterate what the governor said, is make sure that we keep our case counts as low as possible and get vaccinated as quickly as possible to prevent any potential spread resulting from surges in other states.
And Dr. Dunn, going on along with that, I know, there's not a whole lot that's known about the variants out there. With Texas opening up, what does that mean for those variants and how they might spread to other states?
Yeah, so that's the big question, right? What I do know is that the variants are more likely to spread the more cases we have and the less restrictions we have. So the more people are interacting in close contact with each other without masks, the more likely we are to have more variant cases, and that puts us at risk for a huge surge due to the variants, which is what happened in the UK. And so I think we're all nervous about that, and we will watch what happens in Texas and Mississippi very, very carefully. And as far as Utahns go, again, it's so important to just keep our cases trending down by what we know works, and that's physical distancing and wearing masks and getting the vaccine when it's your turn. Okay, thank you guys. Have a great afternoon.
All right, thank you, Dr. Dunn, and to our other speakers. That concludes the press conference for this week, and we will be back to you next week with more information. Thank you very much.